The Korle Bu Children's Eye Clinic, which is one of the 2 centers in Ghana, cater for complicated eye needs of children, and it sees an average of between 50 and 60 cases a week. These are the basic signs parents must jump to and quickly send their children to the hospital.
One good thing is knowing what a normal eye looks like, okay? You know that the surface of the eye, you see this black circle, where actually in front of it is a very transparent thing, okay? And then you see the blackness, and that's all you should see, black in the central part. Sometimes you notice that instead of looking straight at you, one eye is looking away. That's one of the first signs of childhood cancers. It can also be a sign of a refractive error. Like I said, a child who needs glasses, one eye might look away. But one of the most telltale signs that this child has a cancer is when you see a white spot within the black, okay? It's typically described as a cat eye because when light reflects on it, it becomes white and shiny. You know how when lights, like a cat's eye. Yes, it becomes glistening and bright. So most parents will notice this more in the evenings.
But most parents, out of ignorance, dismiss these telling signs or gloss over them as if they were part of the phases of growth. Dr. Sewakwa shares some of the common cases they record.
For us here, one of the main problems we have are congenital cataracts, when there's a whitening of the natural lens in the eye, and it makes them blind, and that they need surgery to remove. We have cases like congenital glaucoma, where the pressure inside the eye increases, the eye gets a bit bigger than normal, sometimes it gets a bit white, and that can also lead to blindness if it's not tackled early enough.
Pediatric ophthalmologist at the Korle Bu Children's Eye Clinic, Dr. Vera Adubia Isuman, is happy to see one of her patients she describes as the longest surviving cancer patients at the unit. She's a little worried, though, that they do not have all the systems to treat and manage these children.
The very early forms of the disease, we are not able to treat that in Ghana. When it's advanced, the eye has to be removed, but there are other forms of treatment that can salvage or that can save the vision and then also save the eye if the lesion is picked early. And in developed countries, they have screening programs where children are screened. We don't have this screening program in place now, but we are working towards that.
Retinoblastoma is the commonest of the childhood cancers, but about 2/3 of the children do not make it because the cases are presented to the hospital late.
In developed countries, they pick the children up early before they turn 2. We are picking them after 3 years of age. And their survival is, out of every 100, well, less than 40% in our situation. In fact, let me quickly add that it has been improving over the years.
Specialists here paint a gloomy picture of what happens when the cancer cases are presented late.
About 2/3 of these children present late with late disease. That means that the disease would have gone outside the eye. And about half of that number, we are not able to cure it. They tend to lose their lives.
The common one is retinoblastoma, and unfortunately, if it doesn't present early enough, we might have to remove the eye in order to save the life of the child. Fortunately here, when we remove the eye, we put an artificial one inside, which looks normal but does not see.
But it's not all gloomy, as I watched one of the success stories of the unit. 10-year-old Papa's mother shed tears for the son she could have lost years ago, but for an early report to the hospital. Papa has been free of cancer for the past 3 years, and the staff of the eye care clinic and family have every reason to celebrate an eye for a life. Martha Krensolakwa, Joy News, Accra.
are some diseases that are perceived to affect adults only, but not knowing that these diseases can also affect children, and childhood cancer is one of such diseases. From the video we just played, I'm sure you can see that it's something that we should create awareness on, that everyone should know, because it's very important. You never know when you can contract cancer, and I'm sure you need to know the signs and symptoms. So today, the Forget Paradise team has taken it upon their heart to create awareness on cancer. And we have a wonderful resource person from the Kolobu Teaching Hospital Oncology Unit, and she's going to help us to understand what cancer is about and the importance of cancer. But before we meet our wonderful resource person, I'd like you to meet our panel for today. So today I have with me Christy. Change your name again. And Christy, you're celebrating your birthday. How are you doing?
Oh,
I'm sure you're in that mood, the birthday mood.
yeah, I'm in the birthday.
Birthday vibes.
Okay, Andre.
So I'm also Andre, popularly known as Trapped Andre.
Hey, I'm Fidaus.
So we'll meet our resource person, and she goes by the name Dr. Nana Akosua-Afari. Doctor, please, you're welcome to the show.
Thank you very much.
How are you doing? How is working?
Oh, I'm doing fine. Work is fine, and we are still pushing on.
Okay,
What
still
about-
with, I'm also fine. Thank you for asking. Still with COVID, how are you managing?
Oh, so COVID is still real, and we are doing our best to protect ourselves on the job, as well as putting on our face masks, making sure people are wearing their face masks in the hospital and everywhere else, and then washing your hands and sanitizing regularly.
Okay. So before we come to you, Doctor, I'd like to know what you guys know about cancer. Christy, I'll start with you.
Yeah, I know that cancer is the abnormal growth of cells in the body.
Oh, okay.
Okay, so I also know that cancer is the abnormal growth of cell, and one of the types you have the leukemia, which affects the blood.
Okay. Cancer is the uncontrolled growth of abnormal cells in the body.
Doctor, please can you give us an understanding of what cancer is?
Okay, so like you all said, you are all right. Cancer is an abnormal growth of cells in the body, and it happens when the cells get out of control. So they are not dividing like they should. They are dividing more rapidly, and they are dividing abnormally. So the cells are no longer performing the functions they are supposed to perform. They have become deadly and dangerous. So that's basically what cancer is.
When you were talking about cancer, you said it's the uncontrollable division of cells. But so it doesn't mean that cancer is not controlled, or there's nothing specific that will cause it, and it just happens abnormally.
So we have some cancers that have causes, and most of these cancers are the adult cancers, like lung cancers that occur in adults, cancers of the gastrointestinal tract that usually occurs in adults. Those ones usually they are caused by smoking. When you smoke, you're predisposed to getting lung cancer, and among others. But with the childhood cancers, there is really no known cause for most of the childhood cancers. It's not as if we can pinpoint it to exactly something that the child did, or the child ate, or the mother or the father did that put the child in that state. Research is still ongoing to know the exact causes of the cancers. Although some cancers can be linked to certain viruses, like HIV virus, hepatitis B virus, and also some exposure, environmental exposures like radiation or some pesticides. But the exact causes of childhood cancers is still being investigated.
Okay, so you were talking about childhood cancers and their causes. So does it mean that it's genetic from parents? Or?
So when we talk about the genetic part, it's not that strong, because some cancers occur in kids who do not have any family history of cancers. About 5% of cancers could be genetically inherited, and that's a very small percentage. So we don't. It's not huge. That's more of the retinoblastomas, the eye cancers that we just saw in the video. But most of the cancers are not inherited genetically.
So what types of cancer affects children?
Okay, so cancers can occur in any part of the body, basically the eyes, the face, the chest, the stomach, and everywhere. In kids, the commonest cancers are the lymphomas. they are masses that occur in the face, in the neck, in the chest, and it's a form of a cancer. And then we have the eye cancer, that's the retinoblastoma. It's also very common in kids. It can happen in kids as young as 3 months. A 3-month-old baby can have it. And then you have the cancer of the blood. It's called leukemia. It's also very common in kids. Also brain cancers, or we call it brain tumor, are quite common in kids. And then cancer of the kidney. The kidneys, we call it Wilms tumor. It's also very common in children. So when you come to Korle Bu Oncology Unit, you see the kids there with all these cancers.
Okay, Auntie, please, so is there a vaccine for cancer?
Unfortunately, we wish there was a vaccine for cancer, but there isn't. There is nothing we can do to prevent it as of now.
So does it mean you never know when you can get it? At any time you can get cancer?
That's correct.
Oh, God.
It can happen to anybody at any time, anywhere.
And what makes it more deadly is that you can have it without knowing, and then it grows.
So I think we need to know the signs and symptoms of it, so that maybe you'll be able to detect it earlier.
So it's good you mentioned early, because the good part of it is that 80% of the childhood cancers are curable. So it's almost like we could remove the cancer from there, so that you live your life as if nothing ever happened in your childhood. So some of the signs are persistent and unexplained symptoms. So you keep on having a symptom that doesn't go away, headaches or vomiting or any symptom, weight loss, that is not really getting better. It keeps getting worse. And when I say persistent, something that goes on for 2 weeks is enough to be persistent. So you should seek medical help early. You shouldn't wait for, say, 3 months or 6 months before you go to the hospital, but then it might be too late. And then we come to the eye signs. So like we saw in the video, they can have a spot in the eye. So it's more like the spot that comes in the eye when you take a picture, and then you see this whitish spot in the eye. And then tearing of the eye, reddening of the eye, or the eyes become swollen and bulging out. And then if you see any lumps in any part of your body, if you notice that you are growing some bumps and maybe you thought it was a pimple or it was just acne, but it's now becoming bigger and bigger, and it's not, it's probably painless. There's no pain associated. It's highly suspicious of a cancer. And we usually urge the parents to be always, you could say, palpate or touch their children in their abdomen to see if there's any growth or anything, any hard swellings they can feel in their abdomen, so that they can pick it up early and come early. Also, if you keep on getting pains, body pains and aches, it's not usually normal for kids to be having joint pains. For adults, because of the nature of the jobs and so on and so forth, the stresses, it's kind of common. But for kids to be having joint pains, body pains so much, if the child is not a sickle cell patient, then it's also highly suspicious, and you have to seek medical attention. And then if you have any, we call it neurological signs. Neurological signs are signs that have to do with the nervous system, so the brain and the nerves. So anything has to do with headache, anything that has to do with, you notice your walking is not straight like it used to be, or you notice any of your classmates is now limping, he's not walking like his usual self. And if your handwriting starts to change, it's like you're not able to grasp the pencil well, yes. So it's funny, but it's real. Some of them, it's like the teacher just noticed this child has very good handwriting, but suddenly the handwriting is beginning to get a bit mumbled together, and then it raises eyebrows. And also the speech. You have somebody who is very articulate like Christiana here, and then all of a sudden their speech is slurring. It's also a sign that has to be investigated.
I think some of the symptoms are so petty that you won't even suspect that it's a symptom.
Like the handwriting.
Yeah.
But Auntie, please, a friend of mine told me that there is no cure for cancer. Is it true?
So that is not true. That is one of the myths in cancer. As I said earlier on, if they present early, we can cure the cancer. In fact, for the childhood cancers, the main aim is curative. we want to cure the child so that the child can continue living like nothing happened. So cancer can be cured, but they have to come early. We have had so many types of cancers coming to the pediatric oncology units, and they've all been cured. Some of them, unfortunately, lose their lives. But
can you give us any experience?
Sure. So when I started working at Kolebu Teaching Hospital, it was quite dramatic for me because a lot of these kids with massive swellings and the rest. And then we had one child that came in with a huge swelling on the jaw, a little baby boy, about, say, he was a little more than a year. And the mouth was so big, he couldn't eat, he couldn't feed. You had to put a straw in his mouth to feed him. But after starting the medications, we call it chemotherapy, that's the medications for the curing of the cancer. The mouth just shrunk like magic. So it's so curable. The masses just shrink.
The chemotherapy, is it painful? Like, how is the process?
That's a very good question. Okay. So the chemo has side effects. The chemo has side effects, and the side effects can be painful, like vomiting. It can make the child vomit a lot. It can make you lose your hair. So you can have nice hair, and then all of a sudden, you know, your hair and it starts falling off in patches. So much patches, and then they eventually have to go and crop and do like... I
thought that was as a result of the cancer.
Not necessarily.
Okay.
It's usually as a result of the chemo.
Okay.
I heard it makes your finger tips black.
Yes. So it differs from person to person. For some kids, they get the blackening of the fingertips, they get the vomiting, but they don't lose their hair. Whoa. For some kids, they lose every hair on their body, even their eyebrows, and their eyelashes fall off, but they don't vomit as much.
Okay.
So it differs from person to person. The chemo can be quite painful because usually it's very intensive, and the medication attacks some of the normal cells in your body. So it can cause diarrhea as well, so on and so forth.
And please, so like, how many children get cancer in like a year?
Oh, in a year, worldwide, about 300,000 children a year. That's a lot. It is. It's very common in Ghana. In fact, we project to have about 1,300 to 1,400 cases of cancer in children a year. The only problem is that out of the 1,300, only about 300 of them come to the hospital. So the rest are lost to prayer centers. They are lost to other places.
But also, I had a cousin who accidentally got a pallet.
You got a what?
A pallet fell on his hand.
Okay.
And then his mom didn't send him to the hospital. They resorted to like adding balm and everything, and then it became a tumor. So they sent him to the Kolebu, and at the end he died. So I think if you see the same things, you have to go to the hospital earlier.
That's pretty sad. Yes. So it happens like that. Sometimes there's a fall, or during play the child is pushed and then the child falls and there's a little bump, and then suddenly the bump starts growing out of control. But then the cancer was already there. So it's like that fall or that hit just triggered the cells to start growing abnormally.
And please, can you get cancer from a cut? Like, let's say a rusted nail cut or something like that?
No, you're not going to get cancer.
Hey, but people say you get...
No.
So when you write on your skin
and the ink,
so that
tattooing
is it increases the chance of getting certain types of cancer, like skin cancer. Yeah. But that does not necessarily mean you're going to get skin cancer if you write or you tattoo. But it just increases the chances a little bit.
So, Auntie, please, what
difficulties
do you get in, like,
treating
some kinds of symptoms, like,
Okay, so our number one challenge is funds. It's money, because the drugs are not on national health insurance. So the parents have to pay out of pocket, and the drugs are quite expensive. So it puts a strain on the parents and everybody else, because you can't just sit back and watch the child suffer, all because of money. So that's a major challenge.
Auntie, please, those who are not financially stable and they are out there that are suffering from cancer, do you have any help? Like people are going out to
Yes. So fortunately for us, we have World Child Cancer. That's the shirt I'm wearing. It's an international organization. It's like a charity organization. It's not based primarily in Africa, but they send us donations monthly. We also have some NGOs like Lifeline. Some people just walk into the ward and say, today's my birthday, I just want to bless someone. And then they give some money to cater for some people. So those are some of the means that we get funds to help take care of the kids.
So any other difficulties apart from that?
And also, we usually use a lot of blood products, such as blood, we call something platelets. And we have to be giving it to the patients as we are treating them, because some of the treatment, like the chemotherapy, it causes the patients to have anemia or their blood levels to go low. And some of the symptoms of the cancer is also anemia, and we call something low platelets. Yes. Okay. So we have to be transfusing them often. And you know, in Ghana, people don't usually like to donate blood.
Hey. They say mewu.
Exactly. Like, so they wouldn't donate blood. So we are always in shortage. We are always soliciting for people to donate the blood for us to give our patients. So that's also one major challenge when it comes to the treatment of the children.
So, Auntie, please, what if maybe, let's take it for example, a child doesn't have a mom or a dad, but maybe the child is suffering from cancer and someone sees the person on the road, and the person will bring the child to the hospital and leave the child there. So, what will happen to the child if the child can't buy the drugs, can't pay for the hospital? Like, what will happen?
So, like I said, we have some funds set aside for such children. So we usually cater for them as much as possible. In fact, I should say we are doing a good job at that. I mean, some of them, they have parents, but their parents are not well-to-do at all. So we have to go out and get funds for them. We have the support of a lot of big people around who help us.
So has there been any case where the parents abandon the child because they feel like the child is a burden to?
Yes, there have been such cases, especially the infants, when they are very young. The parents feel helpless, and the stigma attached to having a child with one eye gone. They just decide to just leave the kid.
Because of the society we live in, there are so many superstitious beliefs. And then you can be even blamed. You can be blamed that you did this, that's why the child. Meanwhile.
So how do parents who have such children handle these cases?
So they have to commend the parents, especially because they are very strong parents, very strong mothers, very strong fathers, and they stand by their children. And what happens is that usually the parents should have a support system. So extended family members, grandma, grandfather, aunties, friends all come around. There are some people who do a good job at that. Others too, they don't really have anybody. So we ourselves try and support them emotionally, talk to them, counsel them. We usually hold a lot of counseling sessions for the parents. We have a clinical psychologist who also comes in to talk to the parents if everything is becoming too overwhelming or it doesn't look too good.
So are there any actions we can take as children to prevent ourselves being prone to cancer?
Well, unfortunately, we don't really have anything to do to prevent it.
Oh my God, so it can just happen.
Yes.
Okay.
That's the point. No, don't be. I mean, it's not too common, though. It's not as common as malaria and the rest, thankfully, but it's common.
Okay.
And if you come early, you can be cured. So the whole thing is coming early. Okay. That's the underlying factor.
If you identify these signs and symptoms, how do you get help for the child?
So first and foremost, you have to go to a healthcare center, any hospital or clinic that's practicing orthodox medicine, yes, nearby. Not a herbalist or a prayer camp or a pharmacy, no. You should go to a clinic. you should go to a clinic or a health facility where they will start investigating. So they'll do the basic labs. And if they start treatment and after a while the child is not responding, the healthcare personnel will take it upon himself to refer the case to a higher hospital. If you think the child is not improving, but they are not doing that, then you can suggest to the healthcare personnel that, oh, I don't think it's working. Can we go to a higher facility? That's also fine. Okay, so please, your final words to our viewers and our parents out there about cancer, what we should do to be safe. The final words is that childhood cancer is very real, and it can happen to anybody. It doesn't matter whether you are rich, whether you are poor, it doesn't matter your religion or your tribe. So what we have to do is to watch out for the signs and not be in denial. If you are noticing anything, any mass, any bumps, you should report early, because if it's there, then it's really there. No matter how long you wait, it's not going to disappear magically. So you have to come early. Coming early is a very important step. So that's what I would say. Thank you so much, Doc, for having us on the show. Okay, so we've come to the end of the child protection segment. I hope you guys learned a lot, and I hope you are going to take some advice from what Doctor said. If you show any signs and symptoms, I'm sure you will tell your parents about it and you go to any healthcare facility near you. And we hope today's show benefited you a lot. But we still have a lot more in store for you. Up next is the Word of the Day segment. Please stay tuned.
Queen Anita and Maya. Yeah. So guys, today we are going to be learning 2 words. Yeah. So the first word for today is... It's chemotherapy. Chemotherapy, that's the first word for today, and it's spelled CHEMOTHERAPY. Chemotherapy is spelled again, CHEMOTHERAPY. Part of speech is now. Part of speech. Now, definition. The definition of chemotherapy is the treatment of disease by the use of chemical substances, especially the treatment of cancer by cytotoxic and other drugs. The definition again is the treatment of disease by the use of chemical substances, especially the treatment of cancer by cytotoxic and other drugs. So, Maya, can you make a sentence with the word chemotherapy? Chemotherapy. The child chemotherapy session was so painful. Wow, okay. That was actually a great sentence. So guys, our second word for today is carcinogen. The second word again is carcinogen. Carcinogen is spelled CARCINOGEN. Part of speech, noun. Definition. A substance capable of causing cancer in living tissue. Definition again. A substance capable of causing cancer in a living tissue. Maya, so please, can you form a sentence with carcinogen for me? Carcinogen. His carcinogen level was very high, which made him prone to cancer. Wow, yeah. That was a very, very, very smart sentence. Yeah. So guys, that's all we have for you for the Word of the Day segment. Up next is the birthday segments with Danny Highest and Andre.
Once again, the birthday segment is brought to you by your one and only Danny Highest. And to be assisted with the birthday segment, I have the Trap Don Dre. Charlie Trap Mohene. Yeah, so this week I know that you were on
midterm vibes. Rest in soul, Charlie. Hey, Charlie, next week no full force on our books again,
yeah,
Charlie.
Yeah. So without wasting much time, let's get straight to the birthdays for today. Happy birthday to you, Afi. The grace of God will forever rest on you. Be a blessing to your generation. Enjoy.
Happy birthday to you, Reverend Joe Plange. The grace of God will forever rest on you. Be a blessing to your generation. Enjoy.
We wish you a very warm happy birthday, Mrs. Longmarty. Cheers to life, to life. May you grow very old to see your grandchildren. Amen.
Amen. Happy birthday, Mr. Opoku. May the favor of God continue to rest upon you all the days of your life. Amen.
Happy birthday, Mr. Boating. May you never lack any good thing in Jesus' name. Amen.
Amen. Happy birthday, Kwabna Ejin Hammond. May God grant you all your heart desires. Enjoy your day, sweetie.
Happy birthday, Jose Atani. I pray that you are blessed with everything you wish for and more. We will keep loving you with all our lives, the way we do today. Happy birthday to a lion from another lion. We love you so much. From your sisters, Eliona and Eldin in Siam.
It's your birthday today, Iraqi. Continue to stay blessed. You are loved.
Happy birthday, Eric Siedu Buedi. Cheers to long life and prosperity.
Happy belated birthday to our dear sister-in-law. May your life be full of joy and happiness, grace and favor, blessings and mercy in abundance from landlady Deborah Jonah Webb and Charity Jonah Webb.
Happy birthday, Christiana. You are blessed and highly favored. Keep shining. So this is our own Apusia Papa B, and today is her birthday. We really love you very much.
Guys, so that's all we have for you today on the Who's Birthday segment. I hope you enjoyed us. Don't forget to follow us on Instagram at For Kids Paradise, and on YouTube, subscribe to our channel at For Kids Paradise, and on TikTok as well at For Kids Paradise. Don't forget our challenge is still on. You can also follow me at Instagram on @trapdondre_.
Yes, and also on Instagram, Danny Highest. Up next is the entertainment segment, so stay tuned.
Time for the entertainment segment, and Charlie, we are come to juice you up with some spicy stories. Like these stories are like amazing.
I mean, the Kokonsa queen, you know, like
wow. And we also here with another one, Josephine, another Kokonsa queen.
Yeah, you know.
So guys, so our first story for today is about Funke. No Funke.
Funke Akindele Bello. As if you don't know this lady, you are missing out on Jennifer's Diary, and now the upcoming movie The Window. Like, bro,
actually, Funke actually got upset about her son attempting the craze challenge.
Okay.
So she said that her twins, the boys, they were stacking up packs of bottled water to build a wall of crates, so that they could do this kind of crate challenge.
Wow.
I know this crate challenge is very, very bad.
It's dangerous. Like, it's hurting a lot of people.
People are getting paralyzed. People are dying. And it's bad. You see, what people see on social media, kids are adventurous. What kids see on social media, they'll obviously attempt it. And this should stop. This should, like, stop.
Yeah.
Like, it's very, very bad.
No.
Yeah.
Like,
honestly, I've been, like, seeing it on the internet, how people get hurt just from this. That's, like, attempted suicide. Like, bro, don't.
Like, the thing is so dangerous for kids to practice this thing. Is so dangerous, you know. Like, it's very dangerous. It's not good for kids to practice this in the home.
Okay, so let's take a look at the video, guys, because Charlie, this is so sad.
What is this that you're doing? Huh? Talk to me. Hey, guy. Hello, what is this that you're doing? What?
Pack everything back.
Oh yeah, pack it back, pack it back.
Pick it up.
No, he'll do it, darling.
Pick it up.
Oh yeah, do it, pick it up. Oh yeah, return it. Now.
Pick it up.
Ní men tó rán crate.
Oh yeah.
Oh yeah, dá padà. Ọlọ́run á wò ẹ́. Oh yeah.
Bro, they're kids.
Yeah, they're
They're
kids.
so small.
They're like really tiny.
They've been seeing it online, so they want to practice it, like,
See,
you know.
This grace challenge,
Like,
you don't have to risk your life for it. You can become paralyzed or something, or don't realize. Like, yesterday I saw a video of some certain guy. They say he had finished his exam. He's in the university, and he tried a backflip, which didn't go well for him, and he broke his neck. And people are saying he's actually dead. I don't know if that's really true, but then
It's most likely to happen, bro.
4 years in university just to die.
All the stress and learning. Oh, no.
Right.
No.
Wow, and you know, even Funke doesn't show the faces of her children and everything, and she's protecting them.
I respect that, you know, because like some we spoke about this once on For Kids Paradise about like exposing your children to social media. Some people have their own perspective. Like they would like some people would be okay with it, others would be like, nah. So like respect that. Yeah, that's good.
Yeah, we respect you.
Yeah.
So for our next story, Ghanaian musicians are way above Grammys. Feels ODG says. So he's trying to say that we are way above Grammys. We have the talent to pursue higher things. We shouldn't just base our talent on trying to win an award, but we could go far
more than that.
These things that we are all chasing for.
Yeah, it's true. Yeah, it's true because we have the talent. You know, Ghana, we have a lot of talent hidden in us. So if we move higher and work harder towards it, I think what he's saying is very true.
Well, even in an interview with with Andy Dusty, he says, I think we need to be careful so we don't equate the Grammys to talent. Ghana has some of the best talents that the world has ever seen. In the Afrobeat scene, Ghana has contributed next to Nigeria more than any other country in the world. We have broken records that nobody has ever broken before. So Ghana to me is way above the Grammys, he said.
I totally agree with this because like Ghana, we have like so many talented people.
As you're practicing over here, it's just a talent.
Yeah, it's all talent, and you see most people like look down on Ghana and like don't see like the good aspect of it. But like here, he just proven to us that Ghana, we are great and we're going somewhere.
And even talking about talent, you know. The For Kids Paradise team has been showcasing some dance moves. Like, we even have a challenge.
Juanita, do you know the challenge is still going on? We would like to watch some of the videos like this week.
Me, I'm just here to judge you.
We are all here to judge.
It's very interesting, you know.
Okay,
I see.
The videos are actually nice.
The
but
energy.
I love the first video. Actually.
Yeah.
The first video.
The second one too, she tried.
Mommy, the first one, I'll give you a 9 out of 10.
9 too. 9.
9 or so.
9.
Yeah.
The second video, I give you 6.5.
Oh.
Even though she tried, I like him. Me, I can't dance, so but she tried.
For me, I can dance.
So me, I'll give 8 over 10.
Me 7 because I felt like she should have used the
I
the
changed my
space.
6.5 to 7. Okay.
Yeah, because like she should have used
But
the
more
space at the
energy,
front.
it's very interesting.
Yeah, but she has energy.
Yes.
And she just needs to like use more space and show her legs because like the legs are part of the dance.
The dance too.
Yeah.
Okay, viewers, don't forget to keep on sending your videos. And Charlie, we are not done, no. Up next is the dance segment with Danny Highest as he brings you some dope moves.
Yeah. Stay tuned.
Back to the dance event, and I'm your boy Danny Highest. Yeah, a few weeks past, we brought the light challenge, and it was going on very smoothly. Now we are about to end the challenge, and now we are bringing you a new challenge with Mr. Drew's song.
Peru,
Charlie, guys, it's a vibe. I can't wait for you guys to see the dance. Yeah, so we are doing a part 1 of it. So let's get straight to it.
Yo.
This is part 1 of the challenge. I'll be dropping the part 2 very soon. But for now, I want you guys to anticipate to the part 1. So guys, don't forget to also follow us on our Instagram page at For Kids Paradise. We are always active over there. And also follow us on TikTok at For Kids Paradise also. That we post, training challenges that's going on TikTok. And we just make you smile and have fun.
Don't forget to subscribe to our channel.
Yes, For Kids Paradise. Yeah, For Kids Paradise. Yes, and also tomorrow is actually Christiana's birthday. So we got birthday girl.
Am I dreaming?
May God bless you now.
Yeah.
May God bless you now. May God bless you now.
You said 20 minutes. Are you kidding me?
I just want to pick up something.
What is so important that you gotta pick up?
God bless your new age and have a long life also.
I'm not a priority.
Akosia, our one and only Christiana.
The best dancer ever. Happy birthday to you.
Thank you.
Charlie.
So I want to say to you that may God, grant you more favor, wisdom, and knowledge as you cross this, beautiful and wonderful additional year. May you, be higher than all your allies. May you do exploits and may you be different.
Yeah.
I wish you long life and prosperity. More wishes, more blessings ahead. May you be the head and never the tail. Charlie, bless up, Charlie.
I wish you happy birthday. May God richly bless your new age. Have a long life, intelligence, and everything.
Happy birthday, Christiana. I wish you all the best in life, more knowledge and more wisdom.
To my one and only Akite, since Big Chef, happy birthday, more life. I don't even know what to say, like, bro.
Christiana, my love.
Christiana, long life and prosperity. May all your wishes come true.
Amen.
My baby, happy birthday, okay? Well, enjoy. You said you won't go out with me.
Hey.
So. She said she won't go out with me, but I'll take you out, don't worry. I'll treat you. Okay?
Happy birthday, Christiana. Long life and prosperity.
So guys, we are doing the light challenge. All of us, actually all of us. Everybody.
I know she's going to dance, so you know.
Charlie, the birthday girl has to bless the floor.
Yeah, dancing.
Christiana is dancing. No, let's put the cake down.
So,
You should have. Hey, media, what am I doing here? Hey.
Dancers, no one see any
20 minutes.
so NK, please drop the song.
You know we had plans and this is what we're doing?
I just want to pick up something.
What is something? Fuck it, because I'm done.
Challenge, and also don't forget to check out our new challenge, Super by Mr. Drew. That's the part 1, so you guys should anticipate for it. I really love to see you guys your videos. So as I said, don't forget to follow us on our social media platforms. As for Kids Paradise on Instagram, and as for Kids Paradise on TikTok, as well as subscribe to our YouTube channel. I'm going to upload more content for you to see. Stay tuned every Saturday, 2:00 p.m. Yes, on Joy Prime. So without wasting my time, I would like to say bye-bye to you all and watch next week's show. Bye-bye. So, happy birthday, Christiana. Happy birthday, Christiana.